My MBBS abroad. Call +91 70 36 37 38 39.
Do you get any pain in your chest or anything when you start to cough?
Sometimes it's bloody.
Does it feel like a stabbing pain right there when you start to cough, or does it feel like a lump?
Basically, this patient came in for pneumonia. She has a pre-existing condition of hypertension.
We do our rotations at Milton Cato. We get a lot of experience talking to patients, interviewing patients, doing histories with them. Very, hands-on. Once you start to get into, second and third term, you start doing physical exams. So it's really interesting. You really feel like you're part of the whole process of diagnosis and learning from sickness. So that's been a really great experience.
The rotations that we have at the hospital, which start very early on in term 1, I find them very, very, very helpful to have that patient interaction from the beginning.
Yeah, I definitely think there's a benefit to being able to go to Milton Cato and work with the doctors as well. The main difference between here and back in the United States is that when the doctors are doing their rotations, their work, instead of just following them around, they'll actually let you get up close and personal. For instance, a dislocated elbow that we saw, they'll let you touch and feel and see that this, anatomically, this doesn't belong where it is, and this is how it feels.
Actually, every single time I go to the hospital, I feel like I have a different experience. The second rotation in term 1, where I thought all we were going to be doing is taking histories, I actually got to experience the birth of a child. You suddenly realize this is why I'm here.
I think the most memorable thing was the first time I saw an autopsy. I realized just how fragile human life is, but also how cool it is to really see everything that's there in the textbook, everything that's there in the notes. It was also surreal, but it was very exciting because you know that what you're learning is real, that you're learning is tangible, and that you can really relate.
The anesthesiology rotation that we went on, I got to see several surgical procedures. One that was a little kid with a kidney tumor, and there were multiple surgeons and anesthesiologists working on this kid. That was kind of a big deal.
So when I was in the States, I did a internship kind of thing, and what I was able to see was very limited, and they made me sit in like a waiting room for a lot of it. Whereas here, when we do our rotations at Milton Cato, so far I've gotten to see some amputations and a couple of C-sections, and it's been pretty intense, but it's exposure you wouldn't otherwise get, so we're very grateful.
And this is your first hospitalization related to this pregnancy?
No, really. I've been me for the sugar profile.
Okay. And how long were you in the hospital? And did you ever have a blood sugar issue before?
No.
Not during any pregnancies? Does it run in your family at all, any blood sugar problem?
Get bitten by mosquitoes a lot.
Maybe sandfly.
Sandfly. Not really mosquitoes, not much. So you don't live near to a river or have old things around to catch them.
I need to ask some questions about things that you might have been experiencing. The most common of which is an acute viral. So we know that all the things that can precipitate preterm labor, acute viral illness is the single most common.
Other than that, a couple of things like putting on casts from broken arms, anything from just even sutures, really. Recently I saw perforated bowel, and Dr. Hazel did a remarkable job basically patching up the small intestine and the large intestine, so that was quite neat as well.
Last week, I experienced somebody who had a completely shattered leg, bone came through the skin, and it was just phenomenal to see that in reality.
The great thing about Milton Cato is that the doctors trust students more and are more willing to let you do procedures and things like that. So I've helped in, and I've been the second assistant on a couple surgeries. I've sewed someone up in the ER, that kind of thing. And the great thing is that opportunities to go and shadow physicians is great too, because you can just sort of email a doctor and say, I want to come in and on these certain days, and then they're always willing to provide that.
Just after turn 4, I shadowed Dr. J. He's an internal medicine doctor here at Milton Cato. I shadowed him every day for 2 weeks. I was part of his team. So we did rounding every morning and saw patients throughout the afternoons. I got to experience that more closely. And in one word, I would say it was a humbling experience. Just how much people appreciate doctors' work and your help. It's just incredible here.
When did you come to the hospital?
When?
Yeah.
Today.
Today?
Yeah.
Because of your fit last night?
Yeah.
How long have you been sick?
Good while.
What's a good while? A week? A
Yeah,
month?
a week.
Yeah.
What are you sick with,
Do
Kel?
you have to sit down when your fits happen? Do they make you dizzy?
Huh?
Do your fits make you dizzy?
Yeah. Yeah.
About how long do they last?
Good while. Good while.
They last for a good while?
Yeah.
How bad is the pain? Is it really painful? Or
Huh?
just, is it really painful?
Yeah.
What?
Huh?
So I just just an example of a patient could be very challenging. It will take you a while. Patient like this is brought into the ER, dropped off, no relatives, no other history. We go back to the rudiment. We're looking to see if he has signs of trauma, because we can't assume that because
You know what your name is?
we can't get all the information we need.
We don't have opportunities to have a CT scan done every single day. And that's probably one of the most unique experiences here, is that you get to go really hands-on. You have to use your knowledge, you have to use your education to tackle the things that seem really basic in a more developed country, but you learn to look at it from a completely different perspective. And the doctors here have a lot of training in both the way that uses the technology and then the hands-on manner. And I think I'm learning so much and I'm really prepared, and I know a lot of my colleagues feel the same way.
We have branches in Chennai, Trichy, Kumbakonam, Bengaluru, Vijayawada, Tirupati, Vishakhapatnam, Hyderabad, Khammam, Malappuram.